So thank you all for being here for this discussion about the impacts of climate change on women's health. My name is Daniel Farmer. I work for Physicians for Social Responsibility of Pennsylvania, or PSRPA. We work to protect public health and to protect communities impacted by the oil and gas industry. We are also members of a national coalition to advocate for stronger environmental protections called the Climate Action Campaign. Today's speakers represent various perspectives on the unique impact of climate change on women. Women's History Month serves as an important reminder that the way women experience and are impacted by the climate crisis is not always the same, and that women's voices are critical if we want to see a healthier world. So without further ado, I invite Dr. Joniqua Ceasar, who is a pediatric specialist in Philadelphia and a PSRPA board member, to share some remarks.
Good afternoon. Thank you for having me. My name is Dr. Ceasar, and I work in Philadelphia. I'm a member of the PSR, as mentioned, and I just want to share some remarks as a pediatrician and as a primary care physician. I see firsthand how extreme heat affects the health and well-being of families and children in Philadelphia. Rising temperatures are not just an environmental issue, they are a public health crisis, particularly for our vulnerable patients, children, pregnant individuals, and those with chronic medical conditions. Extreme heat exacerbates respiratory illnesses, increases the risk of dehydration and heat exhaustion, and contributes to worsening conditions such as asthma and eczema. Children are especially at risk because their bodies are less efficient at regulating temperature. When exposed to excessive heat, they can quickly develop heat-related illnesses, which, if untreated, can lead to hospitalization and, in severe cases, death. Philadelphia's air quality crisis further compounds these risks. The American Lung Association gave Philadelphia failing grades for ozone and particle pollution and ranked it the 46th worst city for particle pollution in the country. This is particularly concerning, given that 21% of children in Philadelphia have asthma, more than double the national rate. Outdoor air pollution, especially near roadways and industrial facilities, is a major contributor to this epidemic. Black and Hispanic children in Philadelphia face the highest rates of asthma-related hospitalizations, roughly 5 times higher than non-Hispanic white children. Extreme heat worsens air pollution, increasing the likelihood of respiratory distress and hospitalizations among these children already struggling with asthma and other chronic conditions. Beyond the direct physical effects, extreme heat deepens health inequities. Many families in Philadelphia lack access to air conditioning or live in housing with poor insulation, making it nearly impossible to find relief from high temperatures. Parents working multiple jobs may have limited childcare options, forcing children to play outside in unsafe conditions. Schools and daycare centers without adequate cooling put children at risk for heat stress, affecting their ability to learn and thrive. We have repeatedly witnessed school closures because of the outdated infrastructure of our public schools that cannot provide a safe environment to learn during heat waves. For families already experiencing economic insecurity, high utility bills can force impossible choices between cooling their homes and paying for essentials like food, medications, and rent. This economic strain, combined with the health impacts of heat exposure, creates a cycle of stress that exacerbates mental health challenges for both children and caregivers. Meanwhile, the Trump administration has decimated the EPA's ability to protect our air, land, and water, weakening our capacity to safeguard children and communities from the devastating impacts of climate change. As healthcare providers, we must advocate for systemic solutions to protect families from extreme heat. This includes policies ensuring equitable access to cooling assistance, expanding green spaces and shade structures in urban neighborhoods, and improving housing conditions to make homes and schools safer during extreme weather. We also need better public health messaging and heat emergency planning that reaches all families, especially those in underserved communities. We need the EPA. Extreme heat is an urgent child health issue, and addressing it requires a coordinated effort between healthcare professionals, policymakers, and community leaders. By taking action now, we can prevent heat-related illnesses and save lives, ensuring that all children, all boys, all girls in Philadelphia can grow up healthy, safe, and resilient in the face of a changing climate. Thank you.
Thank you, Dr. Ceasar. Next, I would like to invite Brooke Petry, who's the field organizer for Pennsylvania for Moms Clean Air Force, which is another organization in the Climate Action Campaign Coalition. Thanks, Brooke.
Hi, thank you. My name is Brooke Petry. I'm a field organizer for Moms Clean Air Force, as Daniel just said, and I live in South Philadelphia with my family. I'm really proud to speak today alongside partners and fellow advocates during Women's History Month to call attention to the fact that climate change and women's health are inextricably linked. The impacts of the climate crisis are not gender neutral. Women and girls are disproportionately impacted by climate change, which amplifies existing gender inequalities and uniquely jeopardizes their health, safety, and well-being. Research shows that women are more likely than men to suffer the health impacts of climate change, from heat-related illnesses to injuries and death from extreme weather events. Climate change impacts the air we breathe, making air pollution worse by increasing wildfire smoke and increasing high ozone days. Both heat and air pollution are particularly dangerous for pregnancy, putting mothers and babies at risk. Women carry a disproportionate burden from caregiving responsibilities, and when extreme weather disrupts schools and childcare, it is women who often bear the physical and economic toll. Studies also suggest that women and girls tend to worry more about climate change than men and boys. So even the mental health impacts of climate change are gendered. I'd like to underscore a way that climate change impacts women that I have personal experience with, which is exacerbated asthma. Statistically, women and girls aged 15 and above are more likely than their male counterparts to suffer from asthma. As a lifelong asthmatic and as the mother of an asthmatic daughter, this issue is never far from my mind. Like many families in our community, we don't own a car. That means planning necessary daily errands like the walk back and forth to the grocery store very carefully. During an asthma flare, I need to consider the air quality, the temperature, and the pollution forecast before heading out. Our city of Philadelphia received a failing grade for high ozone days in a recent report from the American Lung Association. It's important to underscore that while women and girls broadly face a greater threat from the impacts of climate change, that threat is not borne equally. Indigenous women, women of color, LGBTQIA people, older women, women and girls with disabilities, pregnant people, and women with less access to wealth bear a disproportionate share of the associated risks. Climate change is a threat multiplier, amplifying risks that so many people face in their everyday lives. Right here in Philadelphia, the urban heat island effect is felt most acutely in neighborhoods that have suffered years of disinvestment due to historically racist policies like redlining. Those same communities also tend to be overburdened by health-harming pollution due to proximity to highways and industrial build-out. Both heat and air pollution have been linked to adverse birth outcomes like low birth weight, preterm birth, and stillbirth. We are living through a moment when the federal government is directly attacking protections that safeguard the quality of our air and the stability of our climate, with the new EPA administrator recommending that the EPA stop its work on climate change and threatening to roll back over a dozen clean air protections. Of course, we must continue to advocate for pollution and climate protections at the federal level and to use every lever at our disposal to hold EPA accountable for living up to its original stated mission of protecting human health and the environment. At the same time, it has never been more critical that state and local governments step in to develop and advance policies that slow climate change, reduce pollution, and protect public health. Moms in Pennsylvania have been vocal in their advocacy for protective state policies, including a durable methane rule to safeguard families from the many health impacts of living up close and personal with oil and gas pollution, reductions in greenhouse gas pollution from our dirty power sector via a robust cap and invest program, home repair programs that improve indoor air quality, reduce indoor allergens, and reduce pollution via energy efficiency, as well as efforts to reduce health-harming and climate-warming transportation pollution via successful frameworks like the Advanced Clean Trucks program and encouraging school districts to give kids a cleaner ride to school on electric school buses. Moms Clean Air Force believes in the power of women, especially moms, to make a difference in the fight for a healthier present and a healthier future. Our members will continue to hold those in power accountable and to advocate for equitable climate and pollution protections for all. Thank you.
Thank you so much, Brooke. Next, I want to invite Miss Gail Pryor, who's a longtime Philadelphia resident, to speak to her experience living in Philadelphia and her experience in climate change.
Good afternoon. I have lived in Philadelphia currently about 40 years now. And a lot of changes in this city has taken place, some good, some better, and some worse. But especially when it comes to our environment and to our housing, it has made my life a little harder. I am also an advocate in the community about climate change and preventions. And I have a program called Crusades to Save a Life. And in the summer, I do workshops for heat prevention, especially for those that are seniors as myself. That helps them in incidents where they can't afford to have air conditioning running all day. So we have cooling centers. If we know in time, we will get them air conditioners or a fan. But anyway, the extreme change of our weather from cold to hot, uh, it has an effect on us, and especially me, with body aches, mental capacity. I just experienced my pipes freezing, and that was stressful. It was uh, it was just an incident that I don't want to see anyone, especially when you're a senior, have to go through this. And my basement, it was flooded from the water. The damage it causes just financially, I'm going to have to deal with it, and they have programs that will assist you, but how well of a job are they doing? And that sometimes just adds to the hill of stress that you're working through to have these things fixed and changed. But when my house is threatened, it feels like I'm being pushed out of something that I've worked so hard to build. And when the temperature rises or falls, I have to maintain and make sure that my utilities are paid. Just last month, I received a bill for $400 for heating, and I have solar panels, and I live here alone. So what's going on? Your roof get weaker, your walls sweat in your home, and I know I have to put up with it because honestly, what else can I do right now? But what I really want to talk about today is not just my physical strain that these changes have caused, but the toll they're taking on my health, my mental health, physically and spiritually. And when the weather is so extreme, the monies that I have to spend in order to keep my house comfortable and safe, where I'm going to get it from? I'm trapped with these high utility bills, raising costs. Impossible. I'm not talking about things that are inconvenient. These conditions are dangerous for my health, my pocketbook, and my peace of mind. And the things is that I'm not alone in these struggles. I see it every day. Me being a block captain, me being a community leader, my neighbors, they come to me for help. I try to get them signed up with assisting programs or programs that assist them with financing their utilities, with fixing up their homes, but how well are they working? These conditions are dangerous, and something needs to be done about it, and especially in our neighborhoods that are low income and worse, Black and brown communities, where we're already dealing with so much poverty and lack, health care, and the systematic lack. Climate change has only deepened these here problems. And as a Black senior mature woman that is single, a homeowner, and a proud Philadelphian, I see how often we are mistreated, ignored, and cast aside, especially when trying to make our voice heard, advocating for ourselves in our community. And there should be more advocacy for seniors. And when working to make a plain effect and express what we're struggling and suffering with, sometimes it's difficult. Because when we speak up about these issues, it's like we're invisible. We're not being taken seriously. And I am tired of hearing people act like the climate change isn't affecting us. It's very important to us. We have to respect our environment in order to live longer, healthier lives, mentally and physically. Very special. And as it affects us in different ways, for Black women like me, it's not just the heat or the cold. It's the weight of the system that doesn't care. If we can afford to live safely, affordably, or in good health, it's the extra stress of trying to protect my family, trying to protect my home, while the powers that be presented like nothing was wrong. I'm speaking today not just for myself, but for all the women who have been left out of this here conversation. It's time for us to take a stand for all the women who wake up in the morning and wonder there's going to be if they're going to be able to afford to keep their home from falling apart, keep food on the table, take their children to the doctor, and be able to afford medicine. For all these women who have to worry about whether their children will be safe from the dangers of extreme heat or flooding. From all the women who have had to live with these here issues, their whole lives have been told, has been a told time and a time again and again that their concerns doesn't matter. But mine's matter. And I'm going to stay in the race and stay in the leadership and express and teach as many as I can about how important climate change is to our environment and our communities. Thank you.
Thank you so much, Gail. And thank you to all three of our speakers. Councilwoman Gauthier is in a meeting with the mayor that is going over time. I'm going to give her a couple minutes here to see if she can go on to share her remarks. In the meantime, I do want to invite any of the folks on the stream who may be listening, who are not necessarily here as members of the press, but the Climate Action Campaign is doing a sticker campaign right now to talk about the importance of climate and share some visibility, just like the stripes you see represented in my virtual background. These are the stickers, Climate Can't Wait, with the stripes that represent the average temperatures of the earth over time. And they will send you a sticker if that is something that you're interested in participating in. And I invite you to look up the Climate Action Campaign on any of your social media or on their own website to find a sticker, and also stay apprised of the work that we're all doing. Hey, I see that the council member has joined. Welcome, Councilwoman Gauthier. Thank you so much for being here and fitting us into your schedule. And we're really excited to hear your remarks.
Thank you. I'm so sorry that I had to be late.
No problem.
I guess you can let me know when you're ready.
You're good to go. We heard from Dr. Ceasar, Ms. Petry, and Ms. Pryor, who all shared about their experience. So you're up. Take it away.
Okay. Good afternoon, everyone. I'm very proud to join Physicians for Social Responsibility, Climate for Action, and Moms Clean Air Force to talk about global warming's impacts on women's health. Today reminds us that my work as City Council's environmental chair is about much more than protecting our planet. Because we know climate change is also a health emergency, one that is already plaguing our disadvantaged communities in particular. Philly's children have asthma at more than double the national rate. And every year, hundreds of Philadelphians end up in the hospital from heat-related emergencies. As global warming accelerates, this will only get worse. So we should be doubling down in our efforts to fight climate change. But instead, President Trump has pulled the plug. Trump decimated the EPA's ability to protect our air, land, and water. He fired EPA staffers working on environmental justice in Philadelphia and canceled funding meant to help us implement the Philly Tree Plan, which has health, climate, economic, and safety benefits. This is only the beginning of Trump's misguided crusade. If Trump weakens the EPA's endangerment funding, more of us will get sick or die from heat and other forms of extreme weather. The air will become even more polluted than it already is, and food security will fall further out of our reach. Here in the city of Philadelphia, we recognize that doing right by the planet also means investing in the long-term success of our communities and our economy. We need the federal government's help, but if we have to go it alone, then we will, because with so much at stake, especially for women, inaction isn't an option. Thank you so much for having me today.
Thank you so much, Council Member, and thank you to all four of our speakers and to members of the press. Thank you for being here. We will be in touch afterward, and for everyone who chose to log into the live stream, thank you for watching. I hope that you learned something of value here, that you tell someone about it, and that you also take the charge in uplifting women's voices in this movement and in all movements. I hope everyone has a lovely week, and we'll be in touch. Bye, everyone.